Good afternoon, and welcome to AskTheHealthSystemCIO.com All-Stars Improving the Patient Experience, a complimentary webinar from HealthSystemCIO.com sponsored by HealthGrid. Just a little housekeeping before we jump into our discussion today. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com, and I will be your moderator today. We encourage you to ask questions. You can send them in at any time, and we're going to take them later in the program. But go ahead and send them in as they occur to you, and I'll keep an eye on those and get them ready for later in the program. You do so by just typing into the Q&A box in the lower right-hand corner of your screen and leave the default set to all panelists. And we have our URL for you to download the deck. You can grab that at any time, and a shortened URL appears at the bottom of all slides. We are recording today's event, and you'll receive an email when the archive has been posted to our YouTube channel. Just so you see how we're going to spend our time today, we're going to go first about 25 minutes with our panel discussion with Kristin Darby, CIO at Cancer Treatment Centers of America, and Myra Davis, SVP and CIO at Texas Children's Hospital. We were to be joined by Neil Ganguly, but he had a last-minute conflict that he couldn't get out of, so we'll just have Kristin and Myra today. And then we're going to hear from our sponsor, represented by Raj Tilleti, co-founder and CEO at HealthGrid. And then we'll continue our Q&A, our discussion. So we have bios here from Kristin and Myra, and I'll be putting those up as they're answering their questions. So we're going to jump right into our discussion on patient experience and improving it and measuring it and all these kind of things. So I wanted to start off by asking for an overview of the organization. So Kristin, would you mind kicking us off?
Absolutely, I'd be happy to. Cancer Treatment Centers of America is a national network of 5 hospitals in the United States that serve adult patients who are fighting cancer. The organization offers an integrative approach to care that combines advancements in genomic testing and precision cancer treatment, surgery, radiation, immunotherapy, and chemotherapy with evidence-based complementary therapies that support patients physically and emotionally, enhancing their quality of life while reducing side effects both during and after their treatments. CTCA serves patients from around the world at our hospitals, which are located in Atlanta, Chicago, Philadelphia, Phoenix, and Tulsa. The organization is consistently rated among U.S. hospitals that deliver the highest quality of care and patient experience. Patient empowerment is core to our philosophical approach to care, which provides patients and their families with comprehensive information about their treatment options and encourages their active participation in treatment decisions. The Information Services Department is a team of approximately 225 employees, which are distributed across all of our locations. The IS department is responsible for all traditional IS functions. In addition to, we also have the responsibility for informatics across the organization. We very much believe that technology is the way we take clinical capabilities at CTCA to new levels of excellence in oncology.
Okay, very good. Myra, a little bit about Texas Children's Hospital.
Yeah, sure. Texas Children's is located in Houston, Texas. We are a not-for-profit organization whose mission is to create a healthier future for children and women throughout our global community by leading in patient care, education, and research. We're very proud to be consistently ranked amongst the top children's hospitals in the nation. We were recently ranked in U.S. News World Report as one of the top-ranking pediatric hospitals in 10 specialty areas. We currently have 3 hospitals, one community-based hospital, one on-site-based hospital, and a hospital for women and women that are birthing children, of course. We support over 40-plus subspecialty services in clinical care. We also have 51 pediatric primary care pediatric practices that are spread throughout the Houston metropolitan area. We have a health plan, and we have 6 health centers, which are subparts of our clinical care practices, specialty practices. And we also now have urgent cares. So we have 3 urgent cares, and we're targeting 5 by the end of the year. The Information Services Department consists of approximately 310 FTEs. The mission of IS is to ensure that we are committed to delivering and sustaining technology solutions in support of our ultimate mission, which is patient care, education, and research.
All right, very good. I want to help the audience understand the impetus for why work needs to be done in this area. So if you could help explain from the best of your understanding from a policy and reimbursement point of view, why is it more important than ever to provide a positive patient experience? Kristin?
Absolutely. Patient satisfaction has received heightened attention as an indicator of provider performance and is an important dimension of value-based healthcare, which I think everyone on this call is probably familiar. We are in the process across our industry of switching from fee-for-service to value-based healthcare. This became a priority in October 2012 when the Accountable Care Act tied patient satisfaction to Medicare reimbursement based on HCAHPS scores. For those that aren't familiar with HCAHPS scores, it tracks patients' perspectives on numerous aspects of care, which include communication with physicians and nurses, care team responsiveness, pain management, communication and clarity of instruction about medicines, discharge information, and the cleanliness of the hospital environment. At CTCA, we believe that patient-centered care is essential. We treat every patient as a unique individual with the understanding that what makes an individual satisfied varies with each person and their perception of care. We strongly advocate patient engagement, which requires actions and behaviors focused on active participation in health and disease management. This is also rewarding in the IS department because we're able to build a relationship with patients through technology that helps them in their fight against cancer. The approach to patient care at CTCA has resulted in all of our eligible hospitals receiving the 5-star quality scores in April 2015, the highest possible rating by CMS. Those ratings are published by CMS and designated to help consumers compare hospitals, and just 7% of the hospitals across the nation receive that 5-star rating.
Okay, very good. Myra, anything you want to add as far as your understanding of what's driving this from a policy and reimbursement point of view?
No, I think Kristin articulated it extremely well. We, too, have the patient as a focal point of attention. We look at our Press Ganey scores with increased awareness and understanding of where our pain points are. We also see this as an opportunity to leverage technology to dynamically engage the patient. We see it as a chance to provide some real-time service. We know that patients are becoming more smart and advanced in how they seek care, and so we are also have at the one of our number one priorities is to increase interaction via the use of technology.
And I think we've seen, and maybe you would agree, that as meaningful use, you know, the word on meaningful use is it's being sunset, it's being changed, it's being phased out. And there's different programs that are coming into place now to focus on this change to quality, like MACRA and these type of things. So I think we all agree that this has got to be front and center of the things you're working on. Kristin, anything you want to add to that?
I think just that I'm incredibly supportive of what I've been reading lately about sunsetting meaningful use. I think the focus has been too much on measurement and not on outcomes. And I think it's not as reflective of the individual needs of patients with different types of conditions, different types of care. And, you know, as we as an industry start to shift to really focusing on patient empowerment, patient engagement, personalized medicine, all of those changes don't necessarily align with the way that we're measuring things effectively. And so I think we've got to be more agile as to how we continue to evolve as an industry and making sure that the regulatory changes continue to align for that so that we don't hamper advancements in any way.
Myra, anything you want to add to that?
Yeah, I think Meaningful Use had good intentions, but I think it was also being treated as more of a project base to receive some level of funding or reimbursements. I think we sort of lost focus on the original intent of it. While I'm happy to see it could potentially sunset, I'm hopeful that the words of meaningfully useful, leveraging the EMR, still stay intact somewhere, because I still think there's some value there.
Okay, very good. Let's now talk about some of the work you're doing. Kristin, why don't you start? I want to talk about your progress, maybe some of the projects that you've worked on here.
Happy to. Our focus has been on understanding the challenges our patients have while they're on site and while issues are occurring so that we have an opportunity to remediate, ensure that we're meeting the patient's expectations. The issue with HCAHPS is that the survey is completed after the patient leaves the hospital, and you don't have an opportunity to remediate at that point. So understanding that, our approach starts with the culture that we establish when a patient walks through our front doors. We ensure they understand their satisfaction and health are our primary concerns, and we continuously request that they notify us immediately if anything is not exceeding their expectations. We are also in the process of implementing a new patient education and entertainment system that provides a platform where we can receive real-time feedback and two-way communication with patients at appropriate points in their hospitalization and begin to customize that experience based on the patient preferences and their personal treatment plan. It's all about making sure they have that connection with the appropriate members of the care team or administrative team when needed. We've also deployed a few digital tools to enhance a patient's opportunity to be engaged in their care. Our proprietary patient portal is a great example where patients receive their test results at the same time as the clinical teams. We believe in transparency and empowering the patient to have the information needed to participate in guiding their treatment journey. This has resulted in us having patient portal utilization in excess of 80%, which is far above the 5% most of the industry is pursuing.
80%. All right, we'll touch back on that in a little bit. Myra?
So we also have a patient and education and entertainment system that's in all of our patient rooms throughout the organization, and we also have the ability for our patients to provide real-time feedback at the point of care. To the point Kristin made, we get the scores and they've been after. So we have someone now from IS that's a part of our family advisory board that listens to particular issues that may come up from families regarding the use of technology, whether it's wireless solutions or the portal that we have. We have a portal in-house. We're continuing to add more functionality to the portal. I like to say more areas of enticing the patients to want to actually go to the portal, such as lab results, bill pay, Spanish, multi-language as well. And so one of the things that we're challenged by right now is the adoption and utilization of portals. While we do a great job marketing our portal, we still have some gaps in the way portals are being promoted when patients present themselves in our environment. I think that's one area of opportunity for us. There's pockets of areas in the organization that are very creative in terms of how they're getting patients to sign up, how they're beginning to interact with patients and share with them. What we're realizing is the more we add from a functionality standpoint to the portal, we believe once promoted, it'll make it easier for our clinics and our care areas to promote the utilization of it.
It sounds to me like one of the things you're both touching on is the transition from purely looking at things after the stay to rectifying issues and capturing the issues and rectifying them during the stay. Kristin, is that correct?
Absolutely. We have to be proactive and engaged to really focus on basically service recovery or re-engaging a patient based on what their needs are while they're still in our facility. And we recognize that every patient has different expectations, and the HCAP scores, for example, which are tied to reimbursement now, they're a general standard question. And so any of us that are familiar with survey methodology understand that everyone interprets survey questions differently. And so what's important is being able to real-time understand what that perception and reality is of your patients, so that if you're not measuring up to how they're perceiving that question, that you have an opportunity to better understand their needs and rectify that before they actually discharge and are no longer within our care.
Myra, definitely focusing on capturing it during the stay?
Yes, and we actually have recently deployed, in addition to technology, we also have a workforce now that are sort of patient satisfaction representatives that are in our ERs, they're in our clinics, and they're spending some time while they're sharing with the patients what the portal is, how to continue to get interaction when they leave. They're also just there to ensure that they are receiving the right level of care while here. And if something that's not right, it's more of a real-time response, a rapid response to addressing it versus allowing them or preventing them from wanting to go somewhere and feel like they weren't heard or we didn't listen.
Very good. Very good. Okay, let's talk about some easy wins, Kristin. What comes to mind is, you know, you guys are far along. That's why you're up here talking. You've made some progress. Some organizations are not going to be as far along, have less resources, smaller community hospital, these type of things. Any ideas on low-hanging fruit in improving the patient experience?
I think what comes to mind immediately, sorry, I'm getting some feedback.
Nope, you sound fine to me.
I hear that also. No, I hear feedback.
Okay, I'm not hearing anything. Can you talk through it?
Yeah, it seems to be gone now. I think what comes to mind immediately is creating a culture focused around the patient. And regardless of resources of any type of facility, that's something that leadership can really put in place. Things like ensuring clinical staff have a few minutes necessary to connect with patients, understand what's important to them, express empathy regarding their situation. I think all of that, really, those personal connections go so far with a patient around their experience that once that gets ingrained in the culture, it makes it much easier for the level of maturity around your patient experience model to continue to progress.
Myra, any thoughts around sort of easy wins or what places to start?
We've had some really easy wins as well, which is, you know, wayfinding has been a big issue for us. Once a family comes on the premises of our medical center here, which consists of many hospitals, it's really hard for them to navigate their way. So that's been a big frustration point. So now we have put in kiosk and wayfinding solutions, such as in the mall, where am I, here's where you're going, et cetera. We're also working on low-hanging fruit, so when we send out reminders, or we call about reminders, even on our website, we're sharing with them exactly what floor to go to, which location we've put in such things as color coordination. If you see red, you're on floor X, and parking is a bear, and it's sometimes a challenge for our families as well. So those have have been really good low-hanging fruit. We've also put in a patient experience executive steering team that I'm a part of, along with our clinical leadership and physicians, and we also have a member of one of our families there, a father, and that's been very helpful to understand what are those pain points. And so I think we're getting more and more integrated with the family, and obviously the patient being at the center of care, and this is something we're paying attention to.
Let's talk about the hardest part, Kristin.
I think once you identify the optimal solutions of the patient engagement model that's right for your environment and your organization, I believe the hardest part is consistency. And the opportunity for us as CIOs is this is where technology can help drive cultural change. The consistency can be built into processes and automated and measured. And technology never forgets the patient is first.
That's a great statement, where technology can help drive cultural change, because we know that culture is not easy to change. So we can continue with that.
Absolutely.
Go ahead.
And once it's part of the operating process that's built into the technology, you can't alter from it. So it helps reinforce that consistency in a way that adoption, you get through the change curves and then things become operationalized where they're the new norm of your operating culture.
That's right. Very good. Let's talk a little bit about funding. Myra, let me start with you on this. There's always a billion competing priorities for a certain amount of money. How do you decide what needs to be allocated to this area? And is the board usually receptive to these types of investments? How can you make your case?
So the determination of allocation is really based off of very compelling reasons, along with data to substantiate it on why certain technologies are needed, and then more importantly, what's the return on that particular investment? How are we going to measure success? And once we actually lay out that plan, and sometimes we are asked, is there a possibility to phase it versus having a lump sum? Maybe there's a way to phase that funding. The board is very receptive. They like to hear the stories of utilization, the testimonies. How did it work for a family? What didn't work for the family? How did we connect another family with each other? Part of what we're looking at is collaboration amongst families about specific diseases, and sharing so that moms and dads can talk to each other about how did they deal with a certain situation for their kiddo. So once we can share those testimonies with the board, and sometimes have a family member there to share in person, that's the easy part. I think the challenge is often in the justification for it. You know, in technology, the numbers aren't small, and so they're sometimes a little scary. It's hard to translate that to value, and so we really work very hard with partners in clinical, physicians, and others to really promote the value, and then how are we going to measure the success of it going forward.
Kristin, is this one place where, again, we hit that soft ROI problem and it's kind of hard to articulate it?
I think that's a challenge with many technical projects that we evaluate every year. One of the things we do just to reground ourselves every year is go back and listen to our patients. I think one of the things culturally I believe in always implementing at any organization I've been at, but CTCA embraces this, is clinical rounding. But being out there with the patient, having lunch with the patient. Everyone in our team does this, and it's a normal part of our operating process. And what that does is get you reconnected with why do patients choose to come to you for health care? In addition to that, what's important to them, why they're going through that journey. Any kind of illness or managing a disease, et cetera, has significant tolls on an individual. And so when you start to understand what they value, you can then take that back to your business functional leads and start to understand what truly are the priorities for what you're delivering around your budget priorities. And one of the things that we implemented last year here is we have a governance process now that all of our function leads across the organization sit with IS and help prioritize what actually is going to be in our portfolio that year and how it's prioritized based on the patient feedback and our business lead feedback to make sure that that business partnership is strong. And then we work with the business leaders to have them partner with us on articulating the ROIs. What is the value? And we make sure that it's not IS pleading the case for technology to help the business that is not being led and sponsored heavily by either a business or clinical leader across the organization that will also commit to that return on investment and work with us diligently throughout the process to measure it and make sure realization is actually received for that investment, whether it's tangible or intangible. And oftentimes, one of the things we find when we put proper methodology around that is there's a lot of unanticipated benefits, and maybe some of the things we originally expected, we learned through the process might not be achieved, but there's other discoveries. And so one of the things we do is we continue to alter those metrics, but making sure that the original case for that investment is always met or exceeded. And then if not, we make sure we incorporate that into our process as a lesson learned so that we continue to advance the maturity of our methodology to make sure that IT investments truly are transformational and are being disruptive enough. One of the things we always say is we crave constructive disruption, and technology is a way to do those breakthrough changes. And so when we look at funding for any type of investment, but patient engagement and any type of experience within our facility, we have to understand that the incremental changes might just be automating bad processes, and we want to really focus on technology building a strong relationship about enabling things that weren't possible previously.
Excellent, excellent. Okay, so now we're going to take a break from our discussion for a minute, and we're going to hear from our sponsor, represented by Raj Taletti, co-founder and CEO at HealthGrid. So, Raj, stage is yours.
Good afternoon, everyone. Good afternoon. This is Raj, HealthGrid. Really appreciate the time today. And as our speakers actually are talking about, HealthGrid pretty much plays in the same sandbox. Actually, they've talked about a lot of things today, and what I want to talk to you all about is just taking all those experiences, but actually converting them to the patient's device. So everything that we talked about today, I will just actually show by example how HealthGrid is able to actually engage the patients through their own devices across the care continuum. So, Anthony, I'm assuming that I have control on the presentation, that I can actually navigate to the next slide?
Yep.
Okay. For some reason, I'm not able to get to the next screen, Anthony. Yeah.
Let me, then I'll forward you slides for you, Raj, and you could just say next slide when you want me to.
Yeah, so let's go ahead and go to the next slide, Anthony. Thank you. Yeah, HealthGrid, as some of you might have noted, we just announced a huge partnership with Microsoft on Monday of this week. We are currently the fastest growing mobile CRM and patient engagement solution in the country, and we actually bring to life all of these experiences that we discussed today. So if you go to the next slide, Anthony. Our customer base, as you can tell, is pretty expansive, extensive. We actually work with various different healthcare organizations that have various different care settings. Today, we have about 3,600 physicians at community health systems using our mobile application for patient engagement. where they don't even have to download an application, but it uses push web technology to patients to get activated. Every patient walking out of the care setting from their ambulatory setting, for example, gets their care summaries texted to their mobile phone. 60% of the patients today are actually engaged through their mobile device as opposed to 5 or less than 10% on patient portals. We're very fortunate to have these marquee clients, and we're continuing to expand in the marketplace. Next slide, Anthony. Sir. So I want to kind of give you guys a little example of patient engagement and patient experience across the care continuum. And again, our speakers today were very, very specific, and they have achieved significant success in patient engagement. And Myra and Kristin, thank you for actually setting the stage for what you guys have done. We've actually taken a chapter, a page or two from your experiences and actually enabled those experiences on the patient's device. If you look at our history, company's history, my history, you can see that we've been innovating patient engagement and patient experience solutions in the marketplace for over 15 years. So a sample patient experience is if a patient called Bill would be activated on the top of the circle on the activation. Bill gets a text message with a link in the text message saying that, Bill, you need to come in for your annual physical through a population health management outreach program, or you can set up an appointment, or you can check in for your upcoming appointment in the next 24 hours. And that text message is coming from, quote unquote, the physician, or if it's an inpatient setting, from the hospital, and they click on the link, a URL link in the text, and they're able to actually put in their last name and date of birth, and all the phone needs to have is a browser, a smartphone. And they're able to sign their forms, they're able to update their demographics, make payments, etc. In various different care settings, so if they're coming in for like a joint replacement or some kind of a procedure, they will also get education. So if you follow that circle anti-clockwise, you can see they get activated, they complete their electronic forms on their phone, they're able to actually review basically education regarding their upcoming appointment, both video and text, reminders, and then I did hear about directions, parking directions. So we actually text them and say, like, okay, you click on this link, here's where you have to park. Here's some pictures of the facility, the maps. And again, it's all just in time because it's actually relevant for that patient at that point in time. And through these push web experiences that we're actually able to go to the patient where they are when they need this, as opposed to them actually going to a monolithic application or a portal, etc. And then as they go into the point of care, the patients and their care team, and in this case could be their family members, can actually get updates of their care in real time. So if they're inpatient, we actually send an update 2 or 3 times. We actually text the patient, and the patient can actually, or the nurse can actually add subscribers like a daughter or a caregiver. You say anytime there's a new medication ordered in patient, please let the care team, the family, know about the medication-related education, or give the family an update at the end of the day what has transpired with the patient. So a lot of very exciting and effective patient engagement at the point of care. And as they leave the building, whether it's an inpatient or an ambulatory care setting, the patient and or their care team, including their family members, are able to receive discharge instructions via a text. Again, the text will have a link where they put in their last name and date of birth, and they're able to see their complete discharge instructions or care summaries. Like I said, patients coming out of community health systems, 3,600 physicians. We activate about 50,000 unique patients a day through text, where they're able to actually retrieve their care summaries on their phone. And post-care, whether it's follow-up for a primary care visit, post-care, whether it is a follow-up for a procedure that they have to go to, or post-care for bundle payments, CJR, et cetera. We're able to actually truly engage their patient and actually bring the device that the patient and their care team, their family members own, right front and center from a patient engagement perspective. Next slide, sir. So I kind of covered both ambulatory and inpatient in the previous slide, but basically this is just a rendering of how patient engagement today, especially for the patients using their own devices, how it's being transformed from the portals to a push web technology, and where we're seeing 12 to 15 times more engagement than traditional portals. And the ROI, like the HCAP scores, we're able to see 20–30% increments. We're able to see, we've proven ROI 12-to-1 in terms of taking out paper, collecting copays, outstanding balances, etc. Next slide, sir. So this is just a rendering of how the application looks like on your browsers, on your smartphones. So pre-care, again, this can be navigated from a text message. When you click on a link, you're able to actually see your demographics. You can update your demographics pre-care. You can sign your consent forms. We're also the first mobile technology in the country certified for IRB, for informed consent to IRBs. All the way to post-care, getting discharge instructions and follow-up messages through the solution. They're also able to communicate two-way and post-discharge. We have partnerships where they can actually engage a pharmacist to ask questions about their medications, or they're able to connect back with the care team. So the next slide, Anthony, basically...
Raj, would you mind if we jump back to our conversation? And I'm happy to bring you into some of the questions as we finish up.
Absolutely, Anthony. Thank you very much for your time, and we really appreciate the opportunity.
Very good, very good. And you'll have plenty, everyone will get those HealthGrid slides in the deck so you can learn more about HealthGrid. I just want to bring our speakers in here and just continue our conversations. We've actually got some really good questions in from the audience. So, Kristin, let's start with you. Can you comment on the relationship of patient privacy to patient retention?
Absolutely. I think I'm trying to figure out what context they were asking that in relationship to. But patient privacy is certainly something that is a primary focus for us and all of our patients. We understand the critical nature and sensitive nature of the healthcare information that we possess, and focus on it very much. From a retention perspective, any of our communications with our patients or interactions, for example, across the continuum of coordinating information between specialists and other individuals across the continuum that might help facilitate building that comprehensive picture around the individual's healthcare experience. The patient, once they consent to that, we actually coordinate all of that communication. In addition to that, our patient portal has an extension where a patient can actually extend access of all of their healthcare information while they're treating at CTCA to any of the other providers that they authorize within their care continuum. And so hopefully that answers the spirit of the question that was raised.
All right, great. Myra, let me ask you the next one that has come in. What do you think are the biggest barriers in HIT to becoming more consumer-empowered, like retail, banking, and other industries? So what specific issues or barriers are there in healthcare that need to be overcome in becoming more consumer, empowering the consumer or the patient more?
Well, I think security is one that equates to trust that my data is safe. I think that's more of that's not a barrier in prevention, just something that's on the radar, and how do we ensure that our patients can trust us with their information. I think the other one is internally more adoption and utilization of it, utilizing and promoting and encouraging the dialogue to be in a secure fashion with the patient through the use of electronics. I think that's probably the biggest barrier, and that's just the one of time and evolution because it's an adaptation.
Very good. Raj, let me ask you a question. You obviously have experience interacting with many, many health systems in this area. When they talk to you about the problem they're trying to solve, what's sort of a common thing you're hearing?
Thank you, Anthony. One of the common themes that we've encountered across our health system is obviously patient portals are not being leveraged 5–10%, and there's about 95%, 80% of the patients that are not being engaged electronically. So we hear that, okay, the meaningful use criteria is good, but it only is not meaningful if you're not able to move the needle in terms of better compliance to reduce costs. So the question that we keep getting is, how can we engage the patient in such a way that we're truly able to improve our class scores, how we're truly able to improve compliance, and show that in a scalable manner? Because case managers and case team members engaging the patients on phone, it's not a scalable model, and they have to restrain themselves to certain type of therapeutic areas where most of the critical conditions are. So they want to have a platform that they can actually have a patient experience that is consistent and effective across their care settings. So whether they go into an ambulatory setting, they might have a different EMR, different portal, inpatient, different EMR, different portal, but how can I actually engage the patient on their device without them having to download a ton of applications?
Right, very good. Okay, Kristin and Myra, I think this is an incredibly important question, especially for our audience. We talked about having a few more minutes, giving the caregivers a few more minutes, maybe the nurses having one patient less. They can give more attention to each patient, and how important these kind of things are in the patient experience, which have little to do with technology. But there are a lot of things, as Kristin mentioned, that technology can do to sort of enforce good habits and to create a solid culture. So the question, let me start with you, Myra. The question is, what is the CIO's role in making these things happen? Are you a leader? Are you a follower? Who has the reins? Who owns the patient experience? Do you then support them, or do you go to them and say, hey, look, there are these great tools. Tell me how you think it should work best.
Yeah, so first of all, everyone owns the patient experience. So it's not, in our environment, in our culture, it's not seen as the problem of an executive over ambulatory area or inpatient. It's all of our problem if patients are not satisfied. So with that said, as I hear of problems or challenges that our patients are encountering, whether we're in our patient satisfaction or experience EST, executive steering team, or outside of it, it's incumbent upon me to share how we can leverage the utilization of our technology, whether it's an EMR, whether it's some other solution we have currently in-house, to help make it easier for the care provider as well as for the patient. Oftentimes, when it's talked about, the challenges are talked about, it's not talked about in the context of, if only we had a solution to do X, Y, Z, it's talked about more in the context of why it's not working, why I'm seeing too many patients, why I'm having to stay after hours to document, why my patients aren't getting checked in on time, et cetera. As I hear those, it's really just dissecting it and getting down to how can we use technology to aid in those solutions, not to be a barrier, not to be something that becomes extremely frustrating, because not not at each time technology will be the solution, right? It could be more around how they're leveraging what they have. It could be the standardization of practice in their clinics. Is everyone standardized, or is it standardized to the point where it's a repetitive behavior across each individual? Those are, it's often a multitude of questions that ultimately could potentially drive a technology solution, or it could be more of a standardization of a workflow or a work stream that can aid in the satisfaction of both the care provider and the family.
Excellent. Kristin, I just want to get your thoughts on that. It'll probably be our final thoughts for today.
Yes, I completely agree with what Myra stated. I will just reinforce, I believe the CIO's role is critical in improving patient experience. We have to be at the table in that discussion, and all of executive leadership and the board needs to be aligned around patient engagement. Being a top organizational-wide goal. I think what's different about the CIO role, though, is we can offer options to enable the goal. So instead of us highlighting the issue or the gaps, I think what we can do is start to change the conversation to transformational breakthroughs that technology can enable to change the way we approach the problem. I believe we have technology tools now that help patients understand their condition, they can express their needs, two-way communication, et cetera, track progress, and take control of their health journey. And we as CIOs need to advocate that path and drive the rest of the leadership team there in ways that, that those objectives are met in a consistent manner.
Excellent, excellent. Well, that's about all we had time for today. I want to thank our panel, Kristin Darby and Myra Davis. I want to thank our sponsor, Raj Tilleti and HealthGrid. As I mentioned, we did record today's event, and you'll get an email as soon as it's posted to our YouTube channel. Excuse me. For those of you who have the CHIME CHCIO certification, attending our webinars gets you 1 CEU, so let CHIME know you've attended, and if you've asked us to, we certainly will. Sponsorship opportunities, you can reach out to Nancy Wilcox. General questions and comments, you can reach out to me. When you close out this window, your WebEx window, you're going to be taken to a survey about our event today, and we would really appreciate you taking a moment to just answer that survey so we can help make our events better. It'll only take you under a minute. And you can go to our website to view our upcoming scheduled events. So again, I want to thank Kristin, Myra, and Raj. Everybody have a wonderful day. Thank you.
Thank you.